Hey, are you a woman and you've ever wondered why you are not always in the mood? Or are you a man and you wonder why you don't always get in the mood as often as you would love to? Or why you have to do a lot of work before your woman is ready to have you do the do? What causes low libido? If you've ever asked these questions, then this video is for you. Hi everyone, I'm Dr. Jides, community physician and public health specialist. Welcome to my channel, and although in this channel we usually discuss women's health and lifestyle, today's video is for men and women. So feel free to share with your male and female friends and partners so that everyone can learn about their libido, and if something is wrong, they can see someone about it. And do well to subscribe to this channel so I can make new videos. Today we shall be discussing the common causes of low libido in men and women. But before we get into the causes, we'd like to understand what low libido is. Libido is also known as sex drive, and low libido simply means a reduced or lack of sex drive. The medical name for the condition is hypoactive sexual desire disorder, HSDD, and it is medically defined as a lack of motivation for sexual intercourse with a lack of desire to either initiate or participate in sexual intercourse. That is, the person does not feel like having sex, not in the mood. And this is a common health problem that affects a lot of women and men alike. The results of studies have shown that 1 in every 5 men have low libido and 2 in every 5 women have low libido. Most times you find that these women tend to avoid situations that may expose them to having sex with their partners, or they just reluctantly do it for fear of losing their relationships or just to keep their relationships. And it's important to note here that everyone's sex drive is different. There's really no scale to measure libido, so there's nothing like normal libido. However, if you find that your level of sexual desire is affecting your relationship or beginning to cause you some form of distress, then you may be suffering from low libido and may need medical advice. It's also important to know that the level of libido is completely subjective. So if you and your partner are happy with what you have going for you, then it doesn't matter. You shouldn't be talking about libido. Some couples are happy with having sex just once in a month and they are not bothered, and that is okay and completely fine. Some couples may have sex like 4 to 5 times in a week and they still feel that their libidos are too low. So it's completely subjective. 40% of women have low libido. However, only 10 to 20% of women are bothered by it, and those are the people that we are interested in. The most important thing about this issue is that the situation must cause significant distress. And what do I mean by that? That simply means that you're beginning to have relationship issues, you're beginning to have personal issues from the problem before you can go ahead to seek some medical advice. So what are the factors that affect libido? The most common factor that causes a reduced libido is age. The older we get, the lower our libido. Many people find that they lose interest in sex as they get older, and this is very natural. And this is mainly as a result of the reduction in sex hormones or age-related health problems or side effects coming from the medications that they may be on. Older men especially have low testosterone levels, which can cause fatigue, depression, and a reduced sex drive. As women start to approach the menopause, the level of the female hormone estrogen starts to drop, and this can affect the libido. The next cause of low libido is relationship problem. And when it comes to libido, the first thing you need to consider is whether you're happy in your relationship. Let me tell you one thing. Sexual arousal is majorly psychological. And if you're having problems in your relationship, you cannot be in the mood to do with the same person. Oh yeah. So ask yourself, are you still attracted to your partner? Do you have any doubts, any worries about your partner? Because this may actually be the cause of your low libido. The next cause of low libido are mental health conditions such as anxiety, depression, stress, exhaustion. Depression especially is a serious illness. Depression actually consists of feelings of extreme sadness for a long time. So if you're feeling low or hopeless, or if you've lost interest in pleasure or doing things that you used to do or things that used to make you happy, you're probably getting stressed. And these things not only affect your mental health, but they are all consuming. They affect every aspect of your life, your physical, your social and mental well-being, and of course your libido. So if you're constantly feeling tired, you're feeling stressed or anxious, or getting consistently sad or depressed, you may need to make some lifestyle changes and maybe see your doctor for advice. The next common cause of low libido is medical problems. If you don't have any relationship problem and with your age being constant, then the most likely cause of low libido may be medical problems. For women, this may include vaginal dryness, painful sex, which could be from infection or other conditions. Please check my video where I discussed some infections that could cause painful sex. If you have reached menopause, you may be going through the genitourinary syndrome of menopause, where you've lost estrogen in the vagina, and this causes the tissue to be very thin and less elastic, and this can cause lots of pain during sexual intercourse. The fear of the pain alone could cause a loss in libido. Gynecological conditions such as uterine fibroids can cause pain with deep penetration and could lead to low libido in the long run. Again, for women going through pregnancy and childbirth adds a lot of stress and fatigue. Although pregnancy is not a disease, but it can lead to low sex drive due to several changes in the body, ranging from exhaustion, which is understandable, to changes in the hormonal level. Funny enough, the hormones in pregnancy could rise and lead to high libido, and sometimes it could actually drop and get low and cause low libido. Many women find that they experience painful sex after delivery due to the trauma and injuries from childbirth. Low sex drive after delivery is very common, so you are not alone if you're in this condition. Having children or even struggling to conceive has also been found to correlate with low libido, so don't be discouraged, you are not alone. For men, you could have erectile dysfunction and premature ejaculation. And other medical conditions that can affect both men and women include diabetes, and this may be due to changes in the nerve function, because diabetes affects nerve functions all over the body and it can cause numbness in the genitals. Heart diseases, high blood pressure, which could be as a result of the high blood pressure itself or due to the medications that have been used to treat it, all of this has been linked to low libido. Chronic pain disorder, which is understandable because if you have pain all over your body, you cannot be in the mood to have intercourse. Thyroid problems, seizure disorders, patients that are recently diagnosed or on treatment for cancers, all of these conditions have been linked to low libidos. Another common cause of low libido is medications. There are certain medications that their side effects lead to low libido. Drugs for high blood pressure, for example, antidepressants, antipsychotics, anti-anxiety drugs like the benzodiazepines, seizure medications, oral contraceptives have also been found to cause sexual dysfunction and reduce libido. You can check the leaflet of the medication you are currently using to see if it has loss of libido as one of its side effects, and then you can check with your doctor to see if you can switch that particular medication to an alternative medication. Another common cause of low libido in both men and women is excessive alcohol consumption. An adult should not take more than 2 drinks in a day for men and 1 drink in a day for women, and that is on the day that you drink, and you're not expected to drink every day. Becoming drunk can cause erectile dysfunction in men, so even if your libido was up to it, the equipment could not rise up to it. Excessive alcohol intake can also inhibit your ability to have orgasm, and this is for both men and women. I hope this video was helpful. If you're dealing with any of the listed causes of low libido, please contact your doctor for medical advice and share this video to anyone you know that may benefit from it. Also, watch out for my next video on how to improve your libido. If you're interested in that, please check the link in the description below or somewhere up here. Thank you all for watching. Please like, as it will help the channel to grow, and it will make my day if you subscribe. Thank you, and always remember, your health matters. Bye-bye.